Joanna has completed the Master of Science in Nursing, Nurse Practitioner program at the UBC in 2015. Upon completion, she moved to Bermuda, where she worked as a nurse practitioner in a family practice clinic. She then returned to Vancouver in 2019 and joined the team at UBC Movement Disorder Clinic. Joanna is able to provide comprehensive assessments to help to manage and care for patients with Parkinson's disease. Her role includes treating the motor and non-motor symptoms of PD, adjusting and initiating medication, and providing additional support in between visits with the MDC, movement disorder specialist. Joanna enjoys empowering patients to engage in exercise and a healthy lifestyle. Next, we have Michelle, who has been working as a physiotherapist since graduating in the UK in 1997 and has worked with clients with neurological conditions across continuum of care for the majority of her career. Since moving to Canada in 2007, Michelle worked in acute care in the neurosciences at Vancouver General Hospital before moving to the Movement Disorder Clinic at UBC in 2017. Michelle has completed an extensive postgraduate training in neurological rehabilitation and was very fortunate to attend the World Parkinson Congress in Barcelona in 2023. Throughout her career, Michelle has taken leadership and educator roles and strived to develop new initiatives to provide the best possible care for clients, empowering them to effectively manage their condition. Michelle feels very fortunate to be part of the client's care team and be able to promote the importance of exercise for brain health. And now I would like to pass it on to our presenters.
Great, thanks, Kelly. Hopefully everyone can see my screen okay here. Just hide this. Okay, there we go. So thanks, Kelly. Before I begin, I would just like to acknowledge that the UBC Vancouver Point Grey campus is situated on the traditional, ancestral, unceded territory of the Musqueam people. I would also like to acknowledge that you are joining us today from many places near and far, and acknowledge the traditional owners and caretakers of those lands. So welcome to today's session on living well with Parkinson's. If you were able to join last week, you would have gone over the treatment of Parkinson's with Dr. McKenzie. This week, we'll be switching gears a little bit to provide you with kind of more practical tips that you can carry out into your daily life that will hopefully improve quality of life and help you live well with PD. So what does it mean to live well with PD? Living well means proactively managing symptoms, staying engaged in meaningful activities, and prioritizing well-being. For many of you, receiving a diagnosis can be overwhelming, and everyone's journey is very unique. Some might take the diagnosis and feel very empowered to do everything they can to live fully, and others might need a bit more time to let things sink in, come to terms with the diagnosis. Everyone will really respond differently, and whatever stage you're at is okay. So for the first half an hour of the hour, we will cover what it looks like to build your care team. We'll talk about tips for medication adherence, remembering to take your medications and how to take them. We'll spend a bit of time reviewing some of the non-motor symptoms of Parkinson's and the management for each. As we'll discuss, there are a few which can really affect quality of life. We will talk about connecting with others, how to stay engaged, staying informed, and staying active. So building your care team. Now, navigating the Parkinson's journey doesn't have to be done alone. And in fact, many patients will do better overall if they tap into the various disciplines that are available to them. So whether you live in a remote town up north or here in Vancouver, it would be really encouraged to try to build your team as much as possible based on what your specific needs are. So ideally, hopefully, most people would be followed by a movement disorder specialist, although this might be a bit more difficult in more remote areas. And some people may just be followed by a general neurologist. So because Parkinson's affects so many different facets to one's health, a team approach can provide a lot of extra support. So a diagnosis could be made by a general practitioner, and then a referral would be made to a specialty clinic. You could be followed by a nurse practitioner like myself who can kind of follow you in between visits with a movement disorder specialist, helping to manage all the symptoms of Parkinson's and adjust medications as necessary. Um, Registered nurses can be very vital to provide additional support, help with non-motor symptoms of PD, and liaise with the specialists. Physiotherapists, which you'll hear from Michelle, are very valuable in helping with things like balance training, range of motion, exercises, stretching and core stability. Occupational therapists can assist with things like making adaptations to daily routines to make things easier. So, for example, if someone has a tremor, they can use weighted utensils, might help with that tremor, minimize that tremor a little bit, or fatigue conservation and management. Speech language pathologists can help with things like dysarthria, difficulty with speaking, low pitch, low voice, as well as swallowing concerns. Social workers, which you would have heard from Elaine last week, are very valuable in helping patients and family members navigate the Parkinson's journey. The bottom line is that there's a whole bunch of support available, and you don't have to feel like you're doing this alone. So moving on to the medication side of things, for many people who are not used to taking medications every day, this will be a very big adjustment. So the dosing schedule for Parkinson's, if on levodopa, for example, will be multiple times per day. An example of this would be 2 tablets at 7 a.m., 2 tablets at 1 p.m., and 2 tablets at 7 p.m. It can be very useful to use an alarm to help remember to take medications. Blister packing or using a daily dosette can be very beneficial, especially if you have multiple comorbidities or other conditions where you have to take other medications as well. So just keeping things a bit more organized in that respect. Creating a schedule for the day can help to optimize your functioning. So, for example, if you take your medications at 7, waiting until the medications kick in. At 8 a.m., you might start feeling a little bit better. Maybe that's the time that you plan to go for your long walk or your exercise, go to the gym, meet with a trainer. Be prepared when refills run out. So this is really important so that you're not scrambling last minute without any medications. And be prepared for outings. So keep an extra supply in your car, in your purse, in the event that you're running late or there's an emergency. So some common questions that I get often: what if I miss a dose? So take the medication as soon as you remember, and then adjust the next dose accordingly. For example, 5 or 6 hours later, whatever the interval is that's how you would adjust it. What if I wake up early or late? So if your normal dose is at 8 a.m., let's say, but you wake up at 6 a.m., you may need to adjust the dose earlier depending on how symptomatic you are. So if you wake up at 6 and you're feeling very, very stiff, or you have lots of tremor, or it's difficult to get out of bed, then you might want to move that levodopa dose up instead of having to wait for 2 hours to take the medication. And then if you do take it earlier, then again, adjust the next dose accordingly. I think Dr. McKenzie probably would have gone over some of the side effects of medications at the last talk. So what if I feel nauseous when taking levodopa? Nausea can be a very common side effect early on, and you can help minimize this by taking levodopa with a carbohydrate snack. So ideally, absorption is best on an empty stomach. However, there are several reasons why I usually suggest taking it with a carbohydrate snack. So these are things like banana, apple, crackers, a cookie, just to help minimize that nausea and improve adherence. Sometimes even taking it with meals is okay if that will allow the patient to actually stick with taking the medication. So nutrition, is there a specific diet for Parkinson's? The focus should really be on a well-balanced diet, ideally lower in processed foods, lower sugar foods, inflammatory foods. There have been several studies looking at the Mediterranean DASH diet intervention for neurodegenerative delay. And these studies have shown that this can have promising effects on helping to preserve cognition. This diet is higher in fiber, protein, omega-3s, healthy fats, all of the vibrant colors that you see here. The DASH diet is the dietary approach to stop hypertension, was initially introduced to help lower blood pressure in patients, which can improve heart and brain health. However, in patients with Parkinson's, we do sometimes worry about low blood pressure. And so this is a specifically focused on eliminating salt in the diet. We have to be a little bit careful with eliminating salt, which we'll get into a bit later. So nonetheless, a colorful diet that's low in processed foods, that focuses largely on vegetables, legumes, healthy fats, seeds, nuts, healthy oils, and proteins would be best. And then another question that we get often is, can I eat protein with levodopa? So firstly, weight loss can be a concern for our patients. So we want to ensure that you're getting adequate calories throughout the day. For many, there can be anxiety around taking medications, and trying to manage food in between those medication times. So ideally, because levodopa is absorbed in the small intestine, when it's broken down into amino acids and then it's absorbed. When protein is broken down, it's also broken down into amino acids, and they tend to compete for action. The protein molecule is being bigger. So if you actually take levodopa with, say, a piece of chicken, the levodopa may not get absorbed as well. Now, not everyone will be aware of that interaction or sensitive to that, meaning if you took levodopa with chicken, your meds may work just fine. That's no problem. For some people, they may be a bit sensitive to that, so they'd have to space out their protein from their levodopa. I find earlier on when we're just getting someone on medications, I try not to focus too much on that just because, we want adherence, we want patients on the medication. So taking it with a meal, if that's easier, then that's easier for everybody, I think. So other tips for healthy eating: choose high fiber foods to help bowels, make life easier. So plan in advance. If possible, getting pre-cut vegetables may help you in preparing foods, making larger batch meals, less trips to the grocery store, pre-cut veggies, box salads, these sorts of things can make life a little bit easier. So moving on to the management of non-motor symptoms, there have been several studies looking at quality of life in patients with Parkinson's, and many of the non-motor symptoms can have a huge impact on quality of life. And these are some of the more common ones that I see in clinic every day: sleep disturbances, bowels, bladder, blood pressure issues, and moving to mood, anxiety, apathy, and depression. So moving to sleep issues, we know that sleep is very vital for managing mood as well as energy levels the next day. So speaking to your healthcare provider about your sleep patterns can be really helpful to identify what the root cause is. Are you having trouble falling asleep? Are you falling asleep okay, but then waking up multiple times per night, unable to fall back asleep? Do you have anxiety in the middle of the night? Are you waking up because there's some symptom that you're having? So you're having some dystonia or cramping in your body. You're having tremor that's waking you up from your sleep. Or are you having bladder issues, bladder frequency, waking up multiple times per night to use the bathroom, which can be very common? Or are you having what we call REM sleep behavior disorder, which can be very common with Parkinson's as well? So it's important to work with your either GP or your Parkinson's care team to identify what is kind of the cause of the sleep issues that you're having, and then we can help you after that. So managing sleep, REM sleep behavior disorder. As I said, this is very common. This is when a patient might have very vivid dreams, talking, yelling, acting out dreams. What you want to do is ensure a very safe bedroom environment. So try to declutter, put pillows between partners just in case there's a little bit of wrestling going on there. Move the bedside table away so that you don't knock it over. Putting mattress on the ground if it gets to that point. Melatonin can help. So melatonin is a natural hormone that we all have in our bodies that helps to regulate circadian rhythm, respond to darkness, letting our bodies know when it's time to go to sleep. And it's known that this can be lower in patients with Parkinson's. And this is one of the reasons why this could be occurring. So taking a low dose of melatonin can help. And then there are also other medications if it's a bit more severe, such as clonazepam, which would need a prescription. So setting yourself up for a good night's sleep. We want you to try to practice what we call good sleep hygiene. So these are sleep habits. Think back to when you were a baby. You have, a certain routine before going to sleep to ensure that you get a good quality sleep at night. So it's the same, ensure you're getting good fresh air, exercise, daylight every day. Try to go to sleep at the same time every night. Trying to engage in something relaxing before bed. So having a warm shower, reading, listening to music, something calming. Limiting screen time before bed. People don't usually like this one, but really for about an hour or 2 hours before bed, you're really not supposed to be looking at any screens. Keeping bedroom solely for sleep and sexual activity only, so no electronics, no scrolling before bed. Address any symptoms that you're having in the middle of the night, as we discussed on the last slide, and then create healthy bed habits, so not laying awake in bed, trying to limit your time in bed to good quality sleep time, not just a place where your bed is somewhere where you just lay and have anxious thoughts. So what the research really shows is that if you say wake up in the middle of the night and you can't get back to sleep, if after 10 minutes you can't get back to sleep, you should actually get up, go to a different dimly lit room, do something mundane, look through a boring magazine. Don't start eating, don't start cleaning, don't start going on the internet. Just try to do something relaxing and then return to bed after about 10 minutes and see if you can fall asleep again. So just so you're really prioritizing your bed for a place where you get a good sleep. So moving on to constipation, this is probably one of the most common symptoms, non-motor symptoms that I help manage every day. So constipation is one of the most common and usually precedes the diagnosis by many, many years. Constipation looks different for everybody. Some patients might have bowel movements every few days, and that's kind of been their norm for a long time. What we would hope for is the goal is to have regular bowel movements, ideally every day, maybe every other day, that's easy to pass, so not a lot of straining. The reason why this is important is because, as I mentioned previously, the levodopa is absorbed in the small intestine, and if you're really packed with stool, you're not having a good bowel movement, then the medication is actually not absorbed as well, and then therefore the symptoms won't be controlled as well. Constipation, excuse me, constipation can also cause a lot of bloating, discomfort, anxiety around not being close to a bathroom. So just trying to set yourself up for a routine where you have a bowel movement, potentially every morning, then you're kind of clear for the day, your medications will work well. So what does the management look like? It's a stepwise approach. So first, we would try to recommend looking at your diet. What can we take away from your diet? Maybe you're eating too many processed foods, that it's higher in sugar, which could be contributing to the constipation. And then what can we add to your diet? So increasing fiber-rich foods, whole grains, oatmeal, flax, hemp hearts, bran, psyllium husk, fruit, bulk vegetables are important. And then some of the more natural laxative fruit containing sorbitol. So these are things like prunes, apples, and pears can be really good for bowels. We want to increase fluids. Now, fluids is a little bit of a catch-22 because when you increase fluids, there's also that increased bladder frequency and urgency in Parkinson's. So trying to increase fluids during the daytime hours and kind of when you're at home, closer to the bathroom. Increase activity and have less sedentary behavior can help. Exercises that can improve the peristalsis of the abdominal muscles can also help. Sit-ups, these sorts of things, aerobics can help. And then lastly, over-the-counter laxatives. So there are a few that we do recommend, the main one being Restore Lax, which is PEG polyethylene glycol. This is a very gentle laxative that can be used long-term. I usually recommend taking it after dinner, and then because it does take a while to work, then by the morning time you wake up, have a warm cup of coffee or tea, something warm to get the bowels going, and hopefully you can aim for a bowel movement then. So managing bladder symptoms, increased frequency, urgency, nighttime voiding, or what we call nocturia, can be common. And what can we do about it? So less water in the late afternoon and evenings is important. I try to recommend limiting water after about 4 p.m. So just smaller sips with meals, smaller sips with medications. Limiting caffeine and alcohol. Pelvic floor physiotherapy can be really beneficial. bladder training exercises, speaking with your GP or NP to get a referral to a urologist can be helpful. And there are medications that we do use. So these medications can help relax the bladder at night and increase flow during the day. And it's also important to note that that men can have enlarged prostates, so it's always important just to make sure that all other health checks are up to date as well. Yeah. Managing lightheadedness, what we call orthostatic hypotension. So essentially, blood pressure is on the lower end. When you stand up, blood pressure drops even more, and then the patient feels dizzy, lightheaded. This can be very common, and the reason why it's important is because it can really increase the risk for someone falling. So it's very important to bring this up with your healthcare provider. So what we would recommend is changing positions slowly, increase water and salt in the diet, check blood pressure regularly, using a compression sock or abdominal binder can be helpful. And then there are also medications such as fludrocortisone or midodrine can be prescribed as well in kind of more severe cases. So moving towards the mood aspect of things, managing anxiety. Anxiety is very, very common, and it can certainly make some of the motor symptoms worse. And so it can be a bit of a vicious cycle. Oftentimes, for example, if patients have tremor, they might feel a little bit self-conscious going into social.
Sorry about this, everyone. It seems we're experiencing some technical difficulties.
Um, as I was saying, if someone has lots of tremor and they are feeling more anxious going to social situations, then that might in turn make their tremor worse and more withdrawal, more from social situations, kind of more isolation. So it's important to break that cycle at some point. Managing anxiety is, there are lots of different strategies we can carry out to manage anxiety. One being exercise. Exercise has been shown to be very beneficial for managing anxiety and depression and Parkinson's. Different types of therapy, so cognitive behavioral therapy, which is looking at the connection between our triggers, our thoughts and actions, and learning calming exercises can help. And many counselors are using this type of therapy. Medications can certainly be beneficial, and some of them even have favorable side effects for patients. Benzodiazepines in the very short term might be okay, but are generally speaking not intended for long-term use. I do encourage, every day we talk a lot about exercise and the importance of that, but I think also carving out time in the day to incorporate calming exercises, meditation, deep breathing, yoga, listening to calming music, going for a walk in nature, something, whatever is enjoyable for you that helps your body calm, reset, kind of disconnect a little bit can really help if you kind of incorporate that every day or at least a few times a week. Managing depression. So mood changes, as mentioned, can often precede the diagnosis by many years. And I think we know that depression can manifest in many different ways, from apathy to withdrawal, anger, sadness, insomnia. So it's really important to reflect on your mood. Is your mood down because of a recent diagnosis, or adjusting to new symptoms that you're having, or have you been struggling with low mood for quite some time and it's just starting to interfere a bit more with your day-to-day activity? So wherever you are at, it's important to bring this up with your healthcare provider. Managing depression requires a very comprehensive approach. It can be managed very well with combination of medication, therapy, and lifestyle adjustments. I think important to note that if motor symptoms, so let's say tremor is getting in the way of your activities of daily living or your hobbies, then, sometimes focusing on that and looking at maybe medications, maybe levodopa, maybe this is the right time to start treatment for this, just because it is starting to interfere with your daily activities and quality of life. Insomnia is often correlated to depression, so treating the insomnia can help boost mood as well. Support groups or speaking to a counselor one-on-one can help to talk through your thoughts, especially if you don't feel comfortable talking to family or friends about this. And all medications are certainly available and beneficial, I think it's also important for us to do our own homework, getting a good sleep at night, getting enough exercise, having that social connection, practicing mindfulness, gratitude can also help shift the perspective and incorporate more mindfulness into the day. And kind of sometimes focusing on what went well during the day instead of focusing on our limitations can help boost our mood day to day. There are several resources available. So these are a few which patients find beneficial. The Calm app, Mind Shift, Mood Gym, Bounce Back, Anxiety BC. The Parkinson Society of BC has some great resources on anxiety and depression as well. So as you'll hear from Michelle, physical exercise is really imperative in helping slow the progression of disease. For many reasons, social connection is also very important. Important for mental health, boosting cognitive functioning, making it more fun. So trying to incorporate a friend or asking a friend to help meet you for your walks or runs or going to the gym can help with adherence to exercise as well. And then joining support groups, talking to others, just so you have that constant connection with others. So making informed decisions. When you're ready, take the time to learn about Parkinson's, learn the language, kicking in, wearing off, dystonia, dyskinesia. There are lots of different kind of medical jargon that we use when talking to our patients. So it can be really helpful when describing your symptoms to understand kind of the language that we do use. And I think it's also important to note that there's a lot of great, overwhelming amount of information out there, and there's also a lot of misinformation. So I think just being cognizant of that and making sure you're getting all of your information from reputable websites. So just key messages. Disease does progress slowly over years and decades. Exercise and medications can control symptoms very well. You don't have to go through it alone. Focus on living the best life you can by being proactive and positive. And advanced therapies do exist, and there is promising research being done. And if we can recommend one thing for Parkinson's, it is movement as medicine and exercise. So starting small, setting goals, finding something you enjoy and can stick with. And on that note, I'll pass it on to Michelle, who will dive deeper into the movement aspect of things.
Good morning, everyone. Thank you for joining us. I too would like to acknowledge that I'm speaking to you from the unceded traditional territories of the Musqueam people. We've all been sitting for a little bit. I'd be a bad physio if I didn't encourage you to move around a little bit, maybe have a little bit of a stretch of your arms, a little move of your body. But we are going to move along just in respect of the time that we have left. So this morning, I'm going to talk to you about exercise. I think everyone knows the importance of exercise in our general health and sort of keeping us independent and helping to maintain our strength and function. So it is sort of one of the ways, as Joanna has talked about, of helping to manage symptoms alongside medication management as well. So when we're thinking about exercise, we're going to take a little look at sort of why we should exercise, when we should do it, what we could be doing and how we could do that, and where are kind of the resources and opportunities to exercise. So just looking at the why. So I think generally most of us will grow up learning and sort of being educated around sort of the importance of activity and moving our bodies to help with general physical fitness, strength, being able to have that endurance for activity. It can help to improve functional tasks. Things like standing up out of a chair, managing going up and down the stairs, getting in and out of a car, in and out of bed. So there are certain activities and movements and range and strength that we'll need in our bodies to help with those functional activities. It can help to improve postural stability. This is a really key area that I focus on a lot. Posture can be affected with Parkinson's, and often people are quite strong in their arms and legs, but we kind of forget about the middle part of our body, and really sort of thinking about that as a foundation. Like in a house, you don't put the walls up and the roof on the house without a really strong foundation. So for our bodies, that's our central sort of postural control and core there. We can look at exercise to help improve balance and coordination, reducing stiffness, increasing our how much we can move our bodies. It can help to reduce fatigue by sort of making sure that you're keeping sort of your energy pot sort of as full as you can, and sort of managing that, trying to ensure we don't get our deconditioned from inactivity. Exercise can help to reduce the risk of falls, again, by looking at balance strategies, then we'll reduce that risk. As Joanna said, it can help to improve mood. It can promote bone health, and that's with weight-bearing exercise. It can assist with bladder and bowel management. And then sort of the research has shown that it can influence brain plasticity and can have a neuroprotective effect, so sort of potentially slowing down the progression of the disease. So when do we want to start exercising? Well, the big answer is, if you're not doing it already, then now. Trying to find a way to incorporate it into kind of your day-to-day and be on a sort of a really good schedule, really good routine, to be able to have this as a long-lasting kind of lifestyle habit. A little unlike an injury, if you have an ankle sprain, you may go to someone and have some exercises until it gets a little bit stronger, and then you probably forget about those exercises and stop doing them. This is more kind of creating that habit more long term. So what do we want to do? So there are lots of kind of guidelines out there. We have the Canadian Physical Activity Guidelines. So this is for adults, and we have an older adult one as well. So looking at least 150 minutes a week of aerobic cardio exercise and strength training at least a couple of times a week. What they have gone on to do, aside from just looking at physical activity, is to look at the 24-hour picture for everyone. And so with that, as well as the physical activity, we're looking to make sure that we're getting good sleep. So 7 to 9 hours of good quality sleep on a regular basis, and then reducing our sedentary behavior. So kind of reducing that to sort of sitting or being sedentary for 8 hours or less in a day, less than 3 hours of recreational screen time, and breaking up long periods of sitting. So when we're thinking about exercise, it may be good that you do your half an hour of exercise or 45 minutes, even an hour. And if you do that sort of say in the morning, and then you sit down for the rest of the day and you're not moving your body, then the effects of that exercise aren't that is less effective. You want to be making sure that you've got more activity spread throughout your day as well. So there are also guidelines set out for people 65 years and older. The difference between the two sets of guidelines being that for the older adult, they do introduce balance as an important aspect to include. And then when we look at the 24-hour picture, the sleep is 7 to 8 hours rather than 7 to 9. So for Parkinson's, there's been a lot of research around exercise. And so intensity has been one aspect of exercise that has been seen to be important. Generally speaking, sort of a higher intensity exercise is important for people to be participating in, but guidelines are sort of moderate to vigorous intensity. And I think it depends on each individual, will depend on any other health conditions that you have. So really, if you're new to exercise, and we'll come on to this in a little bit, it's having guidance from your doctor around this. So these are guidelines, recommendations from the Parkinson's Foundation, again, including the aerobic activity, strength training, looking at balance and agility, and flexibility and stretching. Parkinson's Canada has a similar thing and a little sort of checklist that you can complete. And then moving on to Parkinson Society of BC has a fantastic exercise booklet. Again, giving a little bit of information, explanation around why exercise is important, but then also a series of exercises. So some warm-up exercises, some main feature exercises that you can complete, and some cool-down stretches as well as resource links in there. So a very good book. Moving on, the Michael J. Fox Foundation also has an excellent document around exercise for brain health, and you can go onto the website, click on the link. You just have to put in your email, and then they will send you the booklet to download. So options for exercise. I think this is one of the biggest questions I get, is what should I be doing? Ultimately, it's something that you enjoy, because that's what's going to help you adhere to that more long term. If someone tells you to do something, if you're not really interested, not enjoying it, you might try it for a little while, but then probably over a time, you'll sort of reduce the amount that you're doing, or stop doing it completely. So again, looking at that balance. So it's not just focusing on one piece of the pie, it's looking at sort of the entire pie itself. So including the aerobic, the strength, balance, posture and core stability work, and flexibility. And we also went to include some cognitive dual tasking in there as well, looking at that physical and that cognitive task, and agility work. So options for exercise for PD, I think this is fantastic. There are so many things available out there in the community, whether you live in a sort of a bigger city or a small rural community. I think over the height of the pandemic, a lot more has become available online. So hopefully wherever you are, you can access something. And a lot of resources are available for free. So we have the Parkinson's Wellness Recovery here, LSVT Big, we have PD Warrior, Pedaling for Parkinson's, boxing, dance. Think about sort of that meditation mindfulness that Joanna was talking about, getting out in nature, walking, getting out with family, friends. It may be doing some swimming or aqua aerobics, some Tai Chi, pickleball or ping pong. That's definitely sort of on the rise and quite popular amongst many groups. So just looking at what's available out there in your community, what you're interested in, and what you find really engaging and that you can kind of stick with on a regular basis. So how? So we need to really think around, maybe you're already exercising, but maybe there's one piece of that pie that you haven't included, and you could think about sort of including in your program. Are you brand new to exercise, or maybe you have other health conditions to consider? And so that's where you would potentially want to complete the PARQ, Physical Activity Readiness Questionnaire. And if needed, if you identify some other health concerns, your doctor may need to complete the EPAR-MedX form. Some community classes may ask for that, others may not. So you want to consider also the frequency of exercise, the intensity, the time and type of exercise. So again, sort of thinking about the number of minutes that you need to do across the week according to the recommendations, the guidelines, and how you may break that up in your day, whether you've got half an hour that you can fit in, or whether you're going to break that up into 10-15 minute slots, looking at that moderate to vigorous intensity and sort of that range of exercise. You do want to pace yourself and build up gradually, and it should challenge you physically and cognitively. So usually when I talk with people, I would say sort of Parkinson's, one of the symptoms is it can make movements smaller. You may feel that you're reaching your full potential, but usually there's an extra 10% in there. So whenever you're doing something, you want to think about, if you're reaching your arm out, reach that extra little 10% more to really make sure you're maximizing through that full range and getting as big a movement as you can. We're going to look at sort of where you may want to exercise. So whether you're a person who likes to be out in groups, be part of a class, be connecting with a friend, or whether you prefer to do something individually at home. Maybe you have equipment at home, or you have space that you can kind of follow along with an online video or class there. You want to incorporate some things into your daily routine. So I certainly have clients that while they're brushing their teeth, they may do a few sort of squats at the sink or practice some balance, as long as it's safe to do so. You want to set yourself some goals. So is there something that you're really working towards that you'd like to achieve? Lots of technology aspects to kind of track your progress. I think a lot of people will have smartphones, watches, apps, different things that you may want to think about. There are going to be days where, you know, your body's not feeling as great, not as easy to move. And so it's having a backup plan for those days. Maybe you're not going to do as intense a workout or as much time, but you still want to try and do something as much as you can. You want to seek support from sort of family, friends, and other sort of healthcare professionals, be that a physio, kinesiologist, personal trainer. There are lots of people out there that could provide some assistance. You want to make sure that whatever you're doing it in a safe way, and most importantly, that it really is something that you're enjoying, you're having fun with. And I know a lot of people will connect with other people and sort of really enjoy that experience of motivation of working with other people. So this is just the PARQ. Just some questions that you can ask yourself if you have any other concerns before starting exercise. So when we're thinking about where, again, looking at resources, the Parkinson Society of BC has some fantastic resources around exercise. Shelley, the physio that works with them, does a number of online classes, and then there are archived videos of all the things that she's done over the last few years. So accessing those all for free. The BC Brain Wellness Program is a program that incorporates exercise as one of the elements, but has other activities as well, be that social connections, art, music. So again, most of their programming is for free, and they have some online video resources as well. So NeuroFit BC is a private physio company based both in Vancouver and Victoria. They are a fee for service, but Naomi, the founder, is very passionate. You may have heard her talk or seen her. So she's very passionate about providing resources for people with Parkinson's. And so she has a range of online exercise videos that you can access for free. The Parkinson's Wellness Project is a group in Victoria, again, in person and online resources. If you do want to find a physio, you can look on the website bcphysio.org. You can search by area of practice, so you'd put neurology in, and then it will bring up people in your area that have expertise in working with people with neurological conditions, or maybe they specify Parkinson's. Looking in the community as well, so what programs are available in your community centres. And these are just some coaching programs that are available. So Healthy Steps, Choose to Move, and then you can access a qualified exercise professional through the Health Link. And then some online resources here. So again, lots and lots out there. It can be a little overwhelming. And usually what I encourage people is to kind of go look at the resources, look at some videos, look at some options and try things, and then really work out what works best for you. So we have our sort of our Canadian options, our worldwide. PD Warrior is based out of Australia. And then we have our US foundations and groups as well. So just to bring to a close, our key messages here is that exercise truly is medicine, as well as taking your medications. You want to choose a variety of exercises. Try not to focus on just one area. The important thing is to be as consistent as you can be, sort of creating this lifelong habit of exercise, understanding that there will be little sort of waves in that, and just riding those waves a long time, and then ultimately trying to have as much fun as you can with it. So I'd like to just thank everyone for listening